Hello, everyone. I'm Oscar Llorente. I'm the Director of Network Development and Community Relations, Mount Sinai Medical Center. I'm pleased to be here with you today and take this opportunity to introduce our guest speaker, Dr. Stephanie Shim. Dr. Shim is part of our new orthopedics department at Mount Sinai Medical Center in partnership with Columbia University. She has a great understanding of orthopedics, in particular in wrists and shoulders. Today, she's with us to talk about common hand, wrist injury and problems and when to see a doctor. Dr. Shim has offices in Aventura and in Miami Beach, where she also performs surgery. Without further ado, I welcome Dr. Stephanie Shim.
Great. Thank you so much for the introduction, Oscar. I'm really excited to be here, and I want to thank the city of Sunny Isles Beach for allowing me to speak about this topic that I feel strongly about. So I'm going to go ahead and share my PowerPoint. So I'm Stephanie Shim, and I'm an orthopedic surgeon at Mount Sinai Medical Center at Miami Beach. And I specialize particularly in the upper extremity. So that means really anything from the collarbone, shoulder, all the way down to the fingertip. But today I want to concentrate specifically on hand, wrist injuries, and a common thing that people ask me about: when do they really need to come in to see a doctor versus the emergency room versus trying to treat this at home. So we'll just continue on with the Mount Sinai virtual lecture series. So today, this is by no means supposed to be an exhaustive list of all the things that could potentially happen or that I might see, but I wanted to at least highlight some bad actors and some common injuries that at least I see in both the emergency room as well as my office. So we'll talk a little bit about tendon injuries, any issues with the bones, such as fractures or breaks, joint dislocations. We'll touch briefly upon nerve problems, and that's nerves out in the fingers or also the hand and wrist. Always a scary topic, tumors, but I think that especially can be really critical to identify early, so we'll chat about that. And what I would say is probably the most important part of my talk is actually infections and understanding urgency and when to come in and what you should be looking out for at home. So a little bit about tendon injuries. So the tendons in the hand, you have them both on kind of the front, or what we call the palm surface, or the back, which we call the dorsal surface. And they're really responsible mechanically for what allows you to completely bend down all your fingers, straighten out all your fingers, and bend the wrist back and forth. I think one of the most critical things to realize about tendons in the hand, the fingers, the wrist, are that they're really close to the skin surface. We don't really have the benefit of a lot of tissue, a lot of real estate like you have in maybe the upper arm or the thigh. You're talking really about a distance of millimeters. So things that seem like pretty innocuous injuries in the kitchen, et cetera, can have surprisingly important consequences to be aware of. I included a picture of my professional nemesis, the avocado, and we've been seeing a lot more avocado cutting injuries since the popularization of avocado toast. As my public service announcement for today, I would say if you've never looked up how to carefully and safely cut an avocado, please do so. But I would say, one of the things you can look out for is if you can't fully bend at every joint, at every knuckle in the hand and wrist and completely straighten out, that can be an evidence of something being wrong in terms of the tendon. That's something that you should be really seen for same day of injury. And the reason for that is if you have a laceration, which just means any kind of cut or break in the skin, that should really be appropriately treated to be evaluated for any antibiotic need and to be cleaned out and potentially sutured or stitched up appropriately. So tendon injuries don't necessarily have to come from what I call open injuries or actual breaks in the skin where the knife, glass, what have you, is directly injuring or lacerating the tendon. It can actually all happen from internal damage too, which, as you can expect, might be a little bit harder to diagnose and identify for the patient. These are classically seen in a lot of athletic, exercise, or sports-induced injuries, and I included a couple pictures of common ones that we see as hand surgeons so that you might be aware of them as well. So on the left-hand side, I'm not sure if you can see my mouse coming up, but there's a first picture here where someone's trying to clench their fist. The ring finger is the abnormal finger here. This furthest out knuckle at the finger they're actually trying to completely close that down like the other digits into a full fist, but they're unable to do so. So they can't completely bend down the finger. This classically happens when someone's grabbing an opponent's jersey or their shirt. There's a lot of force going through that hand, and then that opponent suddenly breaks away. That's a lot of force that goes right through that finger and can actually internally rupture the tendon. On the right-hand side, another really common injury that I see, it's called a mallet finger. It is caused by exactly what its name sounds like. So classic example is basketball. You're jumping up for that ball. Finger hits that ball just dead on right at the tip. Again, that's a lot of really powerful force going right through the finger, ruptures that tendon internally. This patient is trying to completely straighten out their finger, but again, you can see right at that knuckle furthest out to the finger, they can't straighten it. That being said, I know these are both examples of tendon injuries all the way out towards the tip of the finger, but you can see that kind of coming, marching all along back the finger and into the hand. So just something to be aware of. Again, if you're having trouble bending and straightening any knuckle of any finger, you should be seen. Again, tendon injuries, in order to appropriately repair them, they should really be done in the first week or two for the best results. The reason why is when a tendon ruptures or breaks or cuts or lacerates, you can almost imagine it like cutting a rubber band. They immediately are going to start retracting. It becomes harder and harder to bring those two ends together. So the sooner you're seen, the better. Obviously, you don't have the open cut here that you have to worry about in terms of an infection. But again, you just want to be getting plugged in sooner rather than later. That being said, I've certainly seen some of these that show up a little bit further out. If you've been a few weeks out from the injury, I would still highly recommend that you come in because being seen late is certainly better than not at all. So we're going to pivot over to bones at this point, and particularly fractures. So just something to be aware of. You'll hear orthopedic surgeons, doctors, certainly hand surgeons use the word fracture often. In day-to-day language, obviously, fracture sounds like something you would expect to be like a hairline break, a partial crack, and most people differentiate that from like a true bone break. But for us, it's actually exactly the same. So whether it's a hairline fracture, a crack in the bone, or completely broken wrist with a lot of different components and parts, we all still call that as an umbrella term of a fracture. So that being said, kind of classically what you would expect to see with a broken bone, any kind of deformity. Here in this picture, you can see there's a clear deformity to that wrist. Not surprised that there's a distal radius fracture or a wrist break, which is very common, unfortunately, but also swelling, bruising, pain, all within normal. That being said, when you've got an internal break, there's no way to 100% know it's broken until you get an x-ray in some scenarios where you don't have the benefit of an obvious deformity. So I say, if you're ever in doubt, just go in and see the doctor, go into the emergency room. Breaks in the bone almost always need some kind of intervention or care at the level of a doctor. It can either go in a brace, splint, cast, or it might even need surgery. So this is something that you should really come in for. When you have breaks that first happen, obviously it can make sense to go to an emergency room, urgent care, somewhere where you can be seen right away. You know, I would say, frankly, if you can come into the emergency room, that makes the most sense, because if that hand needs to be reset, that bone needs to be reset, that's really the setting in which they do it. You want to obviously get medical attention the same day. No one wants to sit at home or go to bed that night with a broken bone that's not stabilized. And then they're going to have you follow up with a specialist, ideally within a week, which I would highly recommend. Whenever you break a bone, preliminary healing starts right away, and things start kind of settling into place by around week 2. So the reality is, if you want to set the bone in the correct position, do the surgery to fix it in the correct position, it needs to really be done in the first 2 weeks. The further you get out from that point, you're going to start getting suboptimal results. That's a generalization. Obviously, there are some special instances where we actually wait a little bit longer, but by far and away, I would say you want to be seen within a week or 2. Moving over to joint dislocations, very common to get finger dislocations, less common to get wrist dislocations. You see that more with pretty traumatic injuries like car accidents, but certainly can happen. Again, not dissimilar from a broken bone, you get a deformity, inability to move the finger. I would say a the vast majority of people tend to pop their finger back into place on their own before they come in and they're seen. We use the term reducing the joint, which just means popping the joint back into place. You know, a little bit controversial in terms of whether I would necessarily recommend that you do it on your own. I will tell you that when dislocations in the finger first happen, it is easiest and most painless to do it right away. That being said, if you're not comfortable, do not have an expectation to do it whatsoever. If you come into the emergency room, we will handle it for you, absolutely. That being said, if you're right on the scene, the finger is popped out of place, you feel comfortable doing it, you can certainly put it back. One thing I would say is try to take pictures of the finger if you can, and if you recall, before you reduce it back into place. The reason is, depending on exactly what direction that dislocation happened, that can really actually change what I recommend, what I do, what kind of brace or splint I put you in. So once you come in after you put the joint in place, without those pictures, I won't actually know which way the finger popped out. So it does help me a lot if you happen to have that. You should absolutely see a hand specialist at some point for this injury. There are little nuances of that type of injury that can have kind of sequela down the road that we obviously want to minimize or prevent altogether. So I would recommend seeing a hand specialist, even if you pop it back into place, because we should really get x-rays knowing, are there any broken bones, any ligament injuries I have to be worried about, etc. So same thing, if it's dislocated, you should really be seen that day. Certainly to put the joint back into place. And then I would want to see you within the first week of when this happened. So nerve injuries in the fingers and the hand. The way these usually present themselves are patches of numbness, tingling, or what people describe as pins and needle sensation, or kind of ants crawling on the skin. I included a picture here. It's a little complex, but it just describes the nerve distribution of the hand. And I think the important take home for this is that there are multiple nerves, and you can see it's pretty complex. You've got multiple branching patterns. Some of those branches join together. What that means is, even if you have one area of the hand that feels completely normal, that does not mean that you necessarily don't have any nerve injury. It might just be a partial nerve injury or one of the nerves that feeds the hand. If you have any numbness, tingling, pins and needles with broken skin, so for example, a bad cut, a bad laceration, that would suggest a direct injury to the nerve, in which case that does need to be repaired. You want to see a hand specialist really as soon as possible. Emergency room certainly is an option, but if we're talking about a nerve repair, the sooner the better, and that's really kind of in a matter of days. So getting seen soon is important. If you don't have any breaks in the skin, that's really more like a bruising of the nerve. We're not worried so much about the nerve being cut. For bruised nerves, we actually leave those alone and let them heal over time. It can be a pretty aggravating process because it can easily take several weeks to a few months to really recover. So I would say if you don't have any breaks in the skin, any cuts, lacerations like that, or any major trauma like joint dislocations, etc., you can leave these alone and watch it. But again, if any concerns, obviously come in and see someone like me. All right, so the ubiquitous carpal tunnel. I wanted to mention this just because obviously it's one of the most common pathologies that I treat, and what a lot of people will have at least some point in their life, not uncommonly, either in themselves or someone they know. So carpal tunnel is actually a nerve issue, and it's specifically the median nerve which feeds these fingers here. So classically, how that crops up is numbness, tingling, pins and needles, specifically in the thumb, the index finger, the middle finger, and a little bit harder to tease out, but actually half of the ring finger. And people will classically describe saying that they wake up in the night with pain, they have to shake out their hands to get comfortable again before they can go to sleep. The reason why it tends to happen at night is that a lot of people will sleep kind of with their hands curled up. The nerve runs right through here in your wrist. So if you're curling up, that puts a lot of pressure and squeezing on the nerve. When you only have occasional nighttime symptoms, that's something that you could actually try just treating on your own at first. And the next slide, I'll talk about options for that. But this is not something that you should leave alone, certainly if it's pretty persistent or if it's getting worse. So I would say you should see a physician if it's getting worse, if you're having any daytime symptoms, and certainly if you feel like you're having any weakness in the hand. Those things can be suggestive of actual nerve damage. And over time, if left alone, that nerve damage can become permanent, so that even if I were to do a surgery, you wouldn't recover full function, which obviously we don't want to get to that point. So in terms of urgency level, again, I would say if you're just having intermittent or occasional nighttime symptoms, you can try that on your own. But if it's getting worse, this is something you want to deal with in several weeks to a few months. I tell patients, listen, you can always give it a couple of months. It's not going to make any difference in the long run, but you don't want to be waiting several months to years, because that's when you're starting to get into permanent nerve damage territory. So carpal tunnel. If you're having just the occasional nighttime symptoms and you want to see if this gets better on its own before coming in to see your primary care doc, or for example, me, then you can actually buy a brace. These are available easily over the counter at your typical Rite Aid, CVS, Walgreens. You can easily also get it off Amazon as well. And if you just put in carpal tunnel wrist brace, you'll get a number of braces that come up. They're all fine. But basically, it's just a wrist brace that helps keep your wrist in more of a straight position at night, so that you won't unconsciously or while you're asleep curl back into that position. I would recommend wearing it at nighttime. You can certainly wear it occasionally throughout the day if you want to, if it makes you comfortable. What I would avoid doing is wearing it 24/7, because that can cause a lot of wrist stiffness that's unnecessary. If you try that for a few weeks and that's not helping at all, then I would recommend coming in and seeing, me. If you can go directly to a hand provider, some people need to have a referral from their primary care doc, but I would see someone, because then they can get you directed over to someone like me who can talk to you about options of steroid injections or even surgery. Less common, it's kind of the sibling to carpal tunnel, is cubital tunnel, which I just wanted to bring up. So what differentiates cubital tunnel from carpal tunnel is that instead of these three fingers being affected, it tends to be more your small finger or your pinky and half of your ring finger, which is how you can differentiate the two. A different nerve territory, which is why it's different fingers that are affected. And actually, when you quote unquote bump your funny bone and you get that sudden funny feeling, numbness, tingling sometimes out to your fingers, that's actually not a bone. You're actually bumping the nerve, which is causing that issue. People will also classically have this at night. The reason why is, again, people tend to curl up their elbows. That causes a lot of kind of compression and pressure at the nerve, which is why that will crop up. Very similar to carpal tunnel in the sense that if you just have occasional nighttime symptoms, wakes you up, you shake it out, you go back to bed, I wouldn't worry too much about that if it doesn't bother you that much. But if it's bothering you a lot, if you have persistent pain, if you're starting to get any weakness in the hand, or sometimes people will actually present with those fingers start to curl down a little bit, absolutely see a provider, because that's something, again, while we're getting into permanent nerve damage territory and we don't want to get there. I will tell you, there are elbow braces you can wear overnight that keep your elbow a little bit straighter. I will tell you, almost 100% of my patients end up taking them off in the middle of the night because they're so uncomfortable, but that's absolutely an option. And I'm going to briefly talk about tumors, but realistically, I'm going to recommend that by far and away, you should probably come in and be evaluated by a hand specialist for these. So I did include pictures of some common benign tumors. I would say at least the image on your left and the image on the middle are easily 75 to 80% of the quote unquote tumors that I see in my office. So the one all the way on the left is a mucus cyst. Completely benign, fluid filled. You'll see sometimes it waxes and wanes, usually not really painful. These are completely benign. You can absolutely leave these alone. And frankly, that's what I usually recommend to most patients. Some people won't like it because of the cosmetic issue, which obviously we can remove if that's the case. The one thing I will say is sometimes these cysts will kind of pop or open up, drain. If that happens, I recommend coming in and seeing a hand specialist, because those cycles of popping and draining can actually lead to an infection that might eventually track deep into the joint, which again can be a bigger issue that we don't want to get to that point. The one in the middle, again, probably the most common one I see, that's called a ganglion cyst. Also similar, and that's a fluid-filled sac. It's actually the same thing as the mucus cyst on the left. It just happens to be a little bit further down into the wrist. Again, I will say these are not really painful. They can sometimes get a little bit bigger, a little bit smaller, but people will sometimes find them uncomfortable. And classically, what people describe to me are your, yoga, Pilates aficionados, people who like to do push-ups. When you're kind of maximally bending back your wrists and putting a lot of body weight and pressure on it, it can cause some discomfort in the back of your wrist. In that case, certainly come in, we can take a look at it. I will personally never recommend an aspiration in the office, which is when we put in a needle and drain it. The reason why is because it almost always comes back. So there's no need to put you through that with a needle or expose you to the risk of infection. If these have to come out, they should really be done surgically. And then last one that I'll just mention is all the way on the right. Some people might be familiar with, but that's called Dupuytren's contracture, which is, there is already kind of a normal fibrous tissue that lives in the palm out to the fingers, but some people will kind of inappropriately cause these cords and thickening of that structure and can sometimes cause the fingers to curl down. Genetically predisposed, nothing that you're doing that's causing it, will classically be seen in older white males, but you can absolutely see it in women and all ethnicities as well. If they don't bother you, you can absolutely leave it alone. But if it's sore or your fingers are starting to curl down, then I would definitely see a provider. Not anything urgent, but there are options, injections, surgery, etc., that can solve that issue. So, don't sit at home torturing yourself. There are options for that. So I created a chart here for, what can often separate benign tumors or masses from malignant tumors or masses and how they act differently. So this is, again, kind of broad generalization. So there's certainly different scenarios where this might be a little bit different, but I would say, generally speaking, most benign masses tend to be stable over years. So that's not really changing during that time. Malignant tumors that we can get concerned about tend to change, tend to get worse, tend to get bigger over time. For benign masses like the cysts I showed in the last slide, sometimes they'll get bigger, they'll get smaller, but they generally don't get consistently bigger. Malignant masses, you'll see that there'll be kind of concerning changes on the skin over top. So that's things like changes in color, like it's turning browner or blacker, dimpling in the skin that's abnormal. The texture of the skin becomes abnormal. Sometimes people describe it like looking like an orange peel or something similar, whereas benign masses tend not to affect the actual texture of the skin. Again, malignant tumors tend to become more painful, and I will say they actually do look scary. They look concerning to the eye. No matter what, I would say when you are playing with the possibility of a sarcoma, a bone cancer, something that could be a serious bad actor, I really think that you should see a specialist and be appropriately evaluated, because somebody with experience needs to take a look at it, assess it, and decide if we need to get advanced imaging to get a better look at the mass. Certainly if there's any role for getting a biopsy or even surgery, and this is something that should not wait. So if you've got a mass and you're concerned, please come in and have that evaluated. And then finally, infections. I know we just have a few minutes, but I'd love to touch on this just because it's so critical. Finger infections, hand infections. Everyone's going to have one at some point in their life, can't get away from it. Classic signs of infection, I think everyone's familiar, but redness, swelling, actual warmth when you touch the skin. Obviously, it's painful. And you can even get kind of systemic symptoms like fevers and chills. Some of these things have a known cause. People will say, I was biting my nails, I got a manicure, I got a cut, I got a dog or a cat bite. But sometimes these don't have a known cause. Sometimes you can even get the infection internally from something else going on, like a urinary tract infection or a lung infection, blood infection, etc. So don't think that you have to have a known cause in order to have an infection. It's a little bit tricky to say in terms of when you should or should not see a doctor. Some of these kind of really early infections, and I think everyone's kind of got that classic, I got a hangnail, it's a little red, it's a little uncomfortable, but I just left it alone and it got better on its own. But sometimes those progress into serious infections that need to be treated medically. What I would say is if there's no improvement during the day, certainly if you're getting fevers and chills, because that's a sign of the infection getting more severe and potentially spreading. Any worsening, any spreading up the hand or fingers or arm, And then pre-existing conditions is one of the most critical components, which I'll go more in depth into. I would see somebody in the emergency room. Certainly you can come into my office if, we do same day, next day appointments. But when you're talking about infection, with some bad actors, those can get bad within a period of hours. So we don't want you to wait. We don't want you to sit at home, certainly not for days or weeks at a time, which unfortunately I do see with some regularity. So I will say there are absolutely infection emergencies. There are infections that we see progress in the span of under an hour, and those need to be medically treated in order to be life-saving, frankly. People tend to be predisposed to these types of infection emergencies. So I just want to touch on some of these conditions. I think a lot of people understand that if you have, diseases that affect your immune system, like autoimmune conditions, HIV, or if you're taking medications that affect your immune system, then obviously you're at higher risk of infection. But there are a lot of other things that actually affect your ability to clear an infection. I would say in my practice, and I think a lot of other hand surgeons would agree, diabetes is a huge issue for us. Obviously, if you're a poorly controlled diabetic, but I would say even with a well-controlled history, unfortunately, you're just a little bit more predisposed to, one, get infections, and two, have trouble clearing them. So just know that if you have diabetes, you need to really be careful with any infections you get and come in and seek immediate attention if it's not getting better. Other things that I'll mention are people who are receiving chemotherapy, people with chronic kidney disease, and if you're on any kind of systemic steroids for any reason, people without allergic issues or lung issues, et cetera, will sometimes be put on oral steroids. Again, I would say bad infections, you need to come into the emergency room immediately. And then finally, I would say, a lot of people, especially during this pandemic, are picking up new hobbies, getting outside, getting active. And I think that's absolutely fantastic. And I want to encourage everyone to do that for your physical, but also your just mental health. But it's also predisposing a lot of people to come into my office with a lot of overuse injuries, new athletic injuries, et cetera. I would say, listen, if you don't have like a specific injury that you can remember, you didn't have like a specific fall, and you feel like it's really more from overuse and you're having more pain, discomfort, and not a lot of the other warning symptoms that I talked about in this presentation, then you can treat this at home for a couple weeks and see if it gets better on its own. And this is kind of the classic algorithm you go through. So you're going to rest it. You can move it around normally, but no heavy lifting, no strenuous work, a combination of ice and heat. I will tell you, ice is good when things are inflamed at the end of a long day or workout, but heat tends to be nice early in the morning before you stretch or exercise, just to loosen everything up. And you can take over-the-counter anti-inflammatories or Tylenol, elevate the affected extremity as much as you can, and then see if it gets better in 2 weeks. If in 2 weeks it's the same, certainly if it's worse, then come in and see me, but otherwise, fine to kind of treat on your own. And I think at the end of the day, what I would like to just say is that, advocate for yourself. No one knows your body better than you. So if something feels off, oftentimes it's because there is something off. It might need somebody like me, like a hand specialist, to kind of identify and parse out what's going on. And I always think it's better to be safe. So you coming into the office, if it ends up being, I'm reassured, you're reassured, you go home and that's it, that's about the easiest visit you can have. That's great. What we don't want to happen is for you to wait too long and then have complications, and that's a much harder visit. So don't feel bad at all about jumping the guns, quote unquote, and coming and seeing me. So thank you again so much for my talk. I think I ran maybe a minute or two over. So again, we're over at Miami Beach at Mount Sinai Medical Center. We also see patients out in Aventura, and this is my group here who's all fantastic. So I'm Stephanie Shim. I specialize in hand, upper extremity, and microsurgery. Dr. Volcano, who's the chief of our department, specializes in foot and ankle and limb lengthening. And then Dr. Vance, she specializes in sports and shoulders. So, we want to be here for all your orthopedic needs, and you have our contact information right there to the right of your screen. We offer same day, next day appointments, and we're happy to take care of our community here. Thank you.
Okay, thank you, Dr. Shim. We have a few questions for our live Q&A section that came from our audience. The first question is, why do doctors put people into the hospital on a small hand inflammation swelling?
Thank you so much. So I think that is a terrific question. In terms of when patients come in with an infection, what makes the difference between whether we send them home, give them oral antibiotics, or whether we actually think they need admission and intravenous antibiotics? That ends up really being a clinical decision. So I know that's kind of a wishy-washy answer, but at the end of the day, there's certain things that we get concerned about. And a lot of the things we talked about, certain patient populations that are higher risk for getting a worsening infection, or certain aspects of the infection we'll see in the emergency room that we're concerned about progressing at home, then we want to observe you. We want to make sure that this actually goes in the right direction, because a few of the things like I talked about, bad infections can turn bad in the span of a couple of hours, and we don't want that happening to you when you're home and there's no one around to kind of observe and then treat you appropriately.
Okay, great. Our second question from the audience is, how do you relieve tension in your wrist to combat carpal tunnel?
Great question. So like we talked about, the nerve there's a finite amount of space for the nerve to cross through here. And when you start kind of bringing down the wrist for extended periods of time or having a ton of pressure right directly over it, you can effectively diminish the amount of space the nerve has to breathe. So I would say best option is to do something like a brace where I showed, which keeps your wrist in more of that straight position so it doesn't tend to drift down. That being said, when you get carpal tunnel severe enough that even at perfect positioning, that space is too narrow, that's when you really need to be evaluated for injection or surgery.
Okay, great. Are there activities that put you at higher risk for developing arthritis?
A very good question, a question I commonly get asked. Actually, for the most part, no. And we find that more and more, it seems that people are just naturally predisposed to getting arthritis over time, that there's a large genetic component to that. And that's both kind of run-of-the-mill osteoarthritis, but also kind of the more known genetic ones that have like a rheumatoid arthritis, like a familial component. So I would say there's certainly some things that predispose you to form arthritis, and that's like bad injuries at the joint, like fractures or breaks of the bone can predispose you to form early arthritis, really traumatic injuries. So sometimes really high level athletes, or if you've had a really bad injury that kind of breaks off or shears off some of the cartilage, that will unfortunately accelerate the arthritis process. But by far and away, for your average person who is, active, does normal exercise, not really anything you're doing that's predisposing you. And frankly, nothing that we've really found that makes a big difference in terms of preventative measures.
Okay, great. And the last question we received was, do ergonomic keyboards and mouse pads actually help prevent carpal tunnel?
So great question. And I think sometimes carpal tunnel falls a little bit victim to having almost too much information or misinformation on the internet, because you can find all kinds of things out there. I will tell you that carpal tunnel is not really caused by any of those things, like using the wrong keyboard, using the wrong mouse. But I think it can be unmasked by it, in the sense that everyone is born with a finite amount of space in their carpal tunnel. Some people are just naturally born a little bit narrower, so they'll be more predisposed or have less of a wiggle room before they'll start experiencing symptoms. And then, like I talked about, in certain positions, if you're bending down a lot, if you're having a lot of direct pressure, that can basically exacerbate any issues you have. So I would say, don't stress about certain things you're doing, like using your cell phone too much or being on your computer too much, as quote unquote causing the carpal tunnel, that you did it to yourself. It unfortunately was already going to be there, but once it's there and you're having symptoms, you can certainly do things like using ergonomic keyboards to kind of offload and prevent having some of those symptoms.
Okay, great. I think that's all the questions we have from the audience for right now. So I think we're going to go ahead and wrap it up. We would like to thank Mount Sinai Medical Center and Dr. Shim and everyone who tuned in today. We will be back again next month on Thursday, April 1st for another live lecture. And be sure to follow the City of Sunny Isles Beach and Mount Sinai Medical Center on social media, where we will be announcing next month's topic. So thanks again, Dr. Shim.
Great. Thank you so much for having me.
Bye.